So there are quite a few other conditions which are associated with gluten intolerance. However, the prevalence of gluten intolerance among these patients kind of less as compared to Sjogren's syndrome, fibromyalgia, osteoporosis, and pseudogout. So this condition includes scleroderma, rheumatoid arthritis, lupus, and so-called juvenile rheumatoid arthritis. It's a form of inflammatory disease affecting mainly children. So because we have a lot of patients in our practice with lupus who have gluten intolerance, I decided to briefly mention what kind of symptoms can be associated with gluten. And these include canker sores, or so-called aphthous stomatitis, vasculitis of the gut, Sjogren's syndrome, which may be secondary in patients who have lupus. Quite often, patients who have gluten intolerance, they cannot tolerate various drugs, and one of them is methotrexate. And finally, inflammation of thyroid gland may be one of the signs of gluten intolerance in patients who have lupus. There are some other symptoms which are a little bit kind of less rare, but still I decided to list them. They include lupus, vasculitis affecting brain and causing encephalopathy, brain fog, damage of peripheral nerves, so-called antiphospholipid antibody syndrome, which can cause blood clots in blood vessels, skin rash over face, and enlargement of lymph nodes. So I'm not going to talk much about non-rheumatic diseases, but this is a scope of conditions which are also associated with gluten intolerance, and you'll be amazed what it covers. So conditions such as schizophrenia, chronic fatigue syndrome, attention deficit, peripheral neuropathy, autism, dermatitis piriformis, obviously, bipolar disorder, and seizure disorder. Quite a few patients who have these conditions, they have unrecognized gluten intolerance, and they can be efficiently treated by just simple gluten-free diet. So when a person comes to our clinic, typically we take a history, and there are certain parts of the history which make it kind of suspicious that the particular person may be dealing with gluten intolerance. These include history of thyroid disorders such as Hashimoto disease of thyroid, which is quite often driven by gluten, history of irritable bowel syndrome, iron deficiency, osteoporosis, Sjogren's syndrome, and asthma. Lately it's been shown that asthma is associated with HLA-DQ8, and again, in a lot of patients it's a gluten-driven disease. That's outside of the scope of our presentation, but you need to remember that if you have asthma, it's feasible to be checked for gluten intolerance. There are certain skin lesions which are highly associated and indicative for gluten intolerance. Keratosis pilaris, kind of bumps over the shoulders, is a very strong predictor of gluten intolerance. Redness around nail beds is called periungual erythema, and also blisters over the elbows, we call dermatitis piriformis. If we see these symptoms, our suspicion that the person is dealing with gluten intolerance goes extremely up. So when we do the blood work, there are certain parameters in the blood work which also make us suspicious for gluten intolerance. For example, low levels of vitamin D1 and D3, elevated parathyroid hormone, presence of antibodies which are specific for Sjogren's syndrome, elevation of prolactin is one of the hormones which in part is regulated by gluten, and some other things like low level vitamin A, low level of retinol. So all these things, when we see them in the blood work, they make us very suspicious that the person may be gluten intolerant. So how do we make the diagnosis? Well, first of all, there is genetic testing. So, and that's what we do routinely in patients who have some evidence of potential gluten intolerance. There are quite a few immunologic testing based on antibodies against gluten and some other proteins, which can be performed on either blood, feces, or saliva. Again, intestinal and colon biopsy is a must if we suspect that the person is dealing with celiac disease, which is, again, extreme form of gluten intolerance. And finally, quite often when we do all these things and the tests are negative and the person is still suspicious that gluten intolerance may be the case, we're asked to eliminate gluten from the diet for 2 or 3 months and then challenge yourself with gluten. And if you can reproduce your symptoms by introducing gluten into the diet, then we presume that you are gluten intolerant even in the absence of genetic or immunologic tests. It's a pure clinical approach, but it does work quite well. So how do we treat gluten intolerance? Well, these are four principles. These are cornerstones of our therapy. Gluten elimination is a must. Correction of metabolic disorders is a second approach. Correction of immune responses. And finally, tumor surveillance. Because what I mentioned in the beginning, that patients have gluten intolerance, they have elevated risk of having lymphomas and colon cancer. So tumor surveillance is part of our therapeutic approach. So let's talk about elimination of gluten. So there are three, again, subsets. Is gluten-free diet, management of gluten contamination, and if you consume gluten, there are some protocols which help you to disrupt gluten from intestinal lining. So when you're gluten intolerant, you need to avoid certain foods, and so this is a list of foods which cannot be consumed. So wheat, with bran, with starch, germ, flour containing obviously wheat, and so on and so on. And so in general, our advice is to see a dietitian when you have gluten intolerance to go through all these things in detail. So when it comes to gluten elimination, there are obvious sources such as bread and bagels and cakes and cookies and so on and so on. And there are hidden sources. For example, how many of you know that candies contain gluten? Or for example, various drinks contain gluten. So gluten is an additive in a number of different products for kind of improve taste and texture, like soy sauce, imitation meat, and so on and so on. Again, it takes time to become a pro and recognize all these things, but eventually if you want to be a real gluten-free, that's a must. So quite often we have patients who say, no, we're gluten-free, but we still have symptoms of gluten. And one of the recent examples from my practice is a person who is very religious with gluten-free diet. I mean, she's been gluten-free for probably 10 years, and she developed an ulcer. She has actually a history of celiac disease, and she was scoped, and the infectious nature of the ulcer was ruled out. So she came to me, we sit down, spent the time, and she told me, you know what? I just recently bought a new brand of lipstick. Let me check whether the lipstick has gluten or not. Surprisingly, her lipstick had gluten. So she stopped the gluten containing lipstick from use, and her ulcer healed up within 30 days. It's an amazing case, but that's what we see in our practice. I remember that a lot of mouthwash and toothpaste have gluten, stems, and animal glues, so don't leak stems because they do have gluten. Right? Prescription and over-the-counter medications can have gluten as part of filling materials. And again, a lot of vitamins, herbs, and minerals, they have gluten as a filler. So when you're consuming all these things and you're gluten intolerant, you need to be very, very careful. That's why we introduce a line of gluten-free remedies to avoid all these potential problems. So, and also talking about elimination of gluten, if you consume gluten and you start getting a reaction, there are several products which can help you to deal with that. Some of them called gluten-breaking enzymes and gluten breakers. These products, they split gluten in your gut, and they decrease the exposure time of your body to gluten. By doing that, they can prevent major problems from happening. So one thing which I want kind of to remind you, it's a real statistics. So only 50% of Americans with chronic illnesses adhere to treatment. And this treatment includes diet, exercise, and medications. And dietary compliance can be the most difficult aspect of treatment, but remember that if you want to get better, that's the way to go. Right? So no deviations from the gluten-free diet if you're real gluten intolerant, because it's all about health, it's nothing else. So how we're going to deal with metabolic disorders? Typically, we're trying to separate it in three major clusters. Management of malabsorption and leaky gut syndrome, therapy of hormonal imbalance, and management of osteopenia and osteoporosis. And there are specific programs designed for each of them. It's so durable, it just it takes time, and it takes some extra effort. So how do we correct metabolic disorders? First of all, we do blood work. We check what is deficient in your blood, and I can tell that most of the patients who are gluten intolerant, they have typically low iron, typically they have low zinc, and typically low vitamin D. So our philosophy is not to use vitamins just in case, it's not just a food, vitamins are medications. You use them for a reason. And before you want to take vitamins, you check your levels and be sure that you know which vitamins you're deficient and which vitamins needs to be taken. It's very easy to overdose vitamin. Like in our practice, we have quite a few patients with vitamin B6 overdose. And extremely high levels of B6 can cause neuropathy. And so it's vitamin-induced neuropathy. It's a reality. So be aware of that. Don't take vitamins just because you want to take vitamins as a part of your routine. See your physician and ask your physician to check all these levels and then start taking whatever you're deficient in. So how do we correct autoimmune responses? So we need to recognize what autoimmune disease is taking place and treat it with specific medications, supplements, and again, diet. And also, second portion is normalization of gastrointestinal ecology. And we have quite a few various products which can fix this problem. They include various probiotics, prebiotics, enzymes, and so on and so on. I don't want to go in specifics because it's a highly individualized process and there are no any kind of universal recommendations. There are a lot of tests available to check for autoimmune disorders and gastrointestinal ecology, and then the therapy is highly customized. And finally, we talk about tumor surveillance. Again, tumor surveillance is part of our therapeutic and diagnostic process because, again, patients who have gluten intolerance, they are at increased risk of having lymphomas and colon cancer. And there's a biochemical surveillance, which we can actually determine by doing blood tests. And physical surveillance includes physical exam, various imaging procedures, as well as colonoscopy. And it's basically about our clinic. We started our clinic in 2008. We're part of the Scripps system. And the mission of our clinic is to provide medical care for chronic inflammatory, autoimmune, and metabolic diseases. And we're using an integrated approach. What it means is that we're using not only medications, but also various non-traditional, traditional technology to help our patients. So thank you, and if you have any questions, I'll be more than happy to answer. Yes?
Which gluten breakers do you use?
We have our own brand. It's called Gluten Breaker. So if you go on our website under gluten-free remedies, you can find it. So basically, initially we designed it for patients who travel a lot, because when you travel and you eat out, you never know what's inside of your meals, right? And so upon request, we designed initially gluten-breaking enzymes and subsequently gluten breaker. And so typically we recommend to take 2 capsules before meal and 2 capsules after meal. And we determined that you can degrade up to 1 gram of gluten if you consume it accidentally. Obviously, if you eat pizza or pasta, it's not going to do much. But let's say if you have a salad, right, and there's some parts of croutons in the salad, it'll help you. And also we use these enzymes so patients who already know that they consume gluten because it can significantly accelerate